Call this meeting of the Bedford, Massachusetts Finance Committee to order on January 15th, 2026. First item of business is the public comment. Does anyone have any comments? Is there anyone online?
No attendees online.
So we can move past that. So then it's library budget presentation. We're moving right along.
Do we have to do attendance?
Oh, you're right. No, we don't. There's no.
Nobody,
No?
nobody online?
We can't.
Phil's in
can't hurt.
charge.
Can't hurt.
I'm not in charge.
Told you I was
George is
I mean,
tired.
just for the minutes, we should do a
Told you
roll
I
call
was tired.
vote.
I rely upon you people to keep me on the straight and narrow.
Oh, you were just being gracious to wait for George.
That's the way to describe it.
Ready, George?
Yes.
Let's do a quick attendance. George?
Here.
Vincent?
Yes.
Bill?
Here.
Ben's here. Tom?
Here.
Alan?
Yep.
Mark?
Here.
Karen? Pretty cool. Everybody's here. Let's get back to the library. We have a new library person. Would you like to introduce yourself and do a quick background? Because I know we'd like to hear it. We were enamored of the previous librarian, so library director.
So I'm Jackie Powers. I started in April, so this is my first budget. I came from Wakefield. I've been there for 15 years in various roles. My last role was the assistant director. I was there for 7.5 years. I'm very excited to be in Bedford. It's a great community.
Richard left things in pretty good shape for you, I think.
A little bit.
Well, he was a good guy.
He was a good guy. When I get to my presentation, you'll see. Some things are a little bit.
I would be amazed if you didn't make change. I'd be disappointed if you didn't make changes.
We've got plenty of those, but so far so good. Can I tell you, should I go ahead and start?
Floor is yours.
So, we came in about $10,000 over the guideline this year, and there's two kind of major reasons for that. The first is that the FY25 salaries budget was $41,000 short. I didn't draft that budget. I can't really speak to what happened. At first, I thought when I got here that it was possibly due to Richard's payout, but it was not. There was a reserve fund transfer, and it didn't change that. So when I extrapolated out the FY26 budget that I inherited, it was looking similarly short. I think we're going to mitigate that with some turnover. We've restructured some positions when people have left, and I think we're going to have some savings, but we are still going to be probably a little bit short. That said, we are quite short of what a library this size with this many open hours needs to fully function and to offer the citizens everything that they really need and want. For context, the library I came from was smaller, but open open the same number of hours, and the salaries budget was fully $250,000 more than we have here. I've checked several other towns, and it's fairly comparable. So I think we probably will need a little bit more. In a perfect world, I'd be asking for a lot more right now, but we're not there financially, and I understand that. So eventually I'll get there when we get to better fiscal times. But given the reality, we're going to do what we can with what we have. And to kind of try and make up that difference, I have proposed to the board that we reduce our hours slightly by about 9 hours starting in July. That's not going to actually necessarily save us money. It's just going to allow us to function, to kind of do a little bit more with what we currently have. It allows us to kind of compress hours, overlap people a little bit more, and kind of get some of the services up to the level that I think the town wants without needing more funding. So the second reason, other than salaries that were slightly over, is that the technology in the library is very, very outdated, and it's way past the point at which it should have been replaced. We're in the process of developing a replacement schedule that would help spread those costs over several years, but to do that, we need to really kind of build up the budget to get there. I saw that previously there was a capital IT line that was, I think in FY25 was rolled into other lines. That money has basically been consumed by software needs, for which there really is no existing line. So I've tried to kind of fix that by adding what I'm calling a professional services line that covers things like software consultants, other contractual services. And to fund that line, I've taken several others and combined them, and I've also taken $7,000 from our materials line. This still leaves us enough to meet the state's mandated materials expenditure requirement. It actually exactly meets it. We also have trust funds, corporation funds that can only be used to buy books. They are restricted. So if I had to dip into those to meet that requirement, I can still do that. I've also, you can see, renamed some of the lines, and I hope the explanations can make those, the movement of those funds clear, but I thought it was important to try and have the names more accurately reflect what those funds were actually being used for. So those are my two reasons for my $10,000, like, 0.6% increase.
The total is, okay. Sorry, George, you want to start?
Start there first. Look at it.
Okay.
All right.
Karen, you want to start?
Sure. Welcome. We're really glad to have you and love the library, so I think we find ways to help. Just looking at the spreadsheet, I apologize.
Which tab are you on?
The summary tab.
Thank you.
So you're considering, you went from the 1668 to 1719, is that,
Yes.
okay. Okay, so, all right, I apologize, I got it now. That was my only question, just trying to understand the bottom line here. Thank you.
Hi, Jackie. I'm Mark Bailey. Welcome. It's good to have you here. You mentioned the technology is really outdated, and you're putting together a plan. We'll look forward to seeing that as it comes together. Could you share just a few kind of anecdotes or examples of what the biggest pulls in that tent are?
In technology?
Yeah, yeah.
So the public computers are from late 2018.
Yeah.
That's quite old in technology. You should be turning them over every 5 years at a minimum. Most of the printers are old. Things have been replaced very piecemeal. So part of the problem that we are having is that things are running on different systems. We have some computers that are able to, that are running like, some are running Windows 10. Some are running Windows 10 until the second it was sunsetted. It had its end of life in October, and some are running it right up into the minute. We have people using Microsoft Word from 2010, which was sunset 7 or 8 years ago. So, and it's all uneven. So the hardest part is getting all the staff computers in the same place, and getting all of the public computers updated and running on, we need new software for them. The user the company that kind of is they run on thin clients. And so they're kind of centrally controlled. That company is sort of sunsetting, I guess, this product. So we need to find another way to do that, and we're exploring other options, but it still requires replacing the computers one way or the other.
And that'll be in next year's budget, or it'll start in next year's budget, and you'll stage it through a few years?
Yeah.
Okay. I mean, I would second Karen's comments. The library is an absolute treasure to this community. It's painful to think of the hours being cut. Did I hear you saying that that you're reducing hours not just to cut the obvious staff costs, but that'll let you?
Right.
Could you just say that again, or say that in a different way?
So we looked at the hours, and we looked at where the traffic is. So we would be kind of shaving a little bit off the morning and a little bit off the end. We're very, very quiet between 8 and 9 p.m.
Well, it's a library.
It's even in the not so quiet parts. We're not planning to cut necessarily any staff hours. We're planning to consolidate them. So where people right now, we're spread very, very thin. So you have one person at each desk. We have one. So it's at night. It's a 34,000 square foot building. We often have 4 people. It's a very, very large building to have that few people. So by kind of squishing everybody together, there's a little bit more overlap, so we can actually do more programs. Right now, it's hard for us to do evening programs. It means leaving the desk unstaffed, which is not great customer service. It also allows us to absorb absences when people are out sick. We right now do not have the staff to call in. I mean, if people call in sick, I am covering the desk, or our assistant director is covering the desk, or we have not had to do this yet, but we do have a minimum staffing policy. I will be very surprised if we make it through the winter without having to just close for an evening because we can't get anyone to come in. So I'd rather try and mitigate that in advance, kind of make those situations less likely to happen. So just creating overlap a little bit more.
Okay, thank you.
Hi, welcome. Question, so last week, there was a lot of conversation about the elevator repair, and I was shocked to learn how old the elevator was. Are there any things from your purview that you see that potentially be as expensive and as costly in the future, given the condition of the library currently?
I can't think of anything that would be as expensive as the elevator. The only thing I believe is on, I want to say it's 5 or 6 years out, is a roof replacement, partial roof replacement.
Yep.
Obviously HVAC system is brand new, so hopefully we don't need to touch that in my lifetime.
Sure.
No, I can't think of anything that is quite that costly. There are 2 elevators. The other one's obviously newer. That one's in the newer part of the building.
Yep.
That one had problems in the last couple of years, but I don't think they were as costly as
Sure.
this current one. I don't see anything down. Most of it is kind of upkeep.
Yeah.
A lot of paint, a lot of masonry type things. I'm not aware of anything that would be on that level.
Gotcha. Thank you. Appreciate it.
Thanks for the budget. It's a lot of good detail. Just going back to the labor deficit. So if in a couple of years from now, perhaps we can hire more people at the library. So say if we scale up to what Wakefield is at, like what type of positions would we have?
I would like another full-time reference librarian and a full-time children's librarian. I know that we have,
Okay.
so that brings the total to, that would bring it to 3 full-time, and then 1 time part-time in both of those departments. I think that would be manageable for 60 hours a week.
Right, okay. You said that was in Wakefield, right?
Yes, that was Wakefield. I also looked at Weston, it was a little bit more comparable in terms of population.
Right.
They're in the same network as us. Their both
Okay.
budgets were between a little over 1.5 million at this point for salaries alone.
Yeah, okay. All right, thank you.
Bill?
Hi, I'm Phil Prince. Thank you for coming. It's nice to see you're kind of doing a fresh take on the library. I think there's a lot of great things happening at the library, but I think a lot of great opportunities as well. So I'm happy to hear you're looking at that. Just a couple of quick questions. First, I was surprised when you said that the IT was so antiquated, and surprised especially that it's distinct from the town IT services. Is there any opportunities there to kind of work or merge with the town's IT systems so that it's like all kind of on one network, all kind of buying software fees for the town, et cetera? Is there a reason that the library is distinct, I guess?
I'm not sure. It's been that way at the libraries I've been in before. I'm not sure if there's a reason for it. Part of it is related to the fact that we are our library's network, Minuteman's library.
Oh,
network.
okay.
So there is some overlap. Our phones are on the town's system. We are currently trying to kind of unpack. My assistant director used to be a head of technology in Chelmsford, so she's very well versed in all this. We're kind of trying to unpack the network situation right now. It's not very clear. We do not have a lot of documentation. So I'm not sure if there's a specific reason here. I've spoken before with Dan Leahy at the head of IT here. He's offered to help. Right now we are without a technology person. But I'm not sure. I don't think anyone really knows exactly why. I know this came up when they did the HVAC project. There's some obviously more computer programming parts to that. It's not just like a boiler anymore. And when they were setting that up, there was some confusion as to, why are we not on facilities network? Why can they can't control theirs the same way they can control ours the way they control the schools, for example. I don't really know why it's set up that way. It's possible we could get over that though. We could adjust that.
Okay.
It's definitely worth exploring.
Excellent, excellent. And then finally, and I think you mentioned this, but I recall vaguely from last year there was a fund that we had to spend a certain amount to get a certain amount?
Yes, so state aid, to get state aid, you have to meet certain requirements. So there is a materials expenditure requirement, which is a percentage of your appropriation, and it's based on your hours open. We currently have to meet, because we are open so many hours, we are at 16%. You can, technically for the size of our, it's actually based on the size of your town. For the size of our town, we actually only need to meet 13%. We do meet 16, which is the higher because we are open more hours. I could easily write a letter, the chair of the board would sign it and say, can we just do it, if we needed to, could we meet the lower requirement, and it would be fine. We wouldn't have trouble getting to the 16% anyway. There is then also an appropriation requirement. We have to meet our average municipal appropriation requirement, I think is the average of your last 3 years needs to exceed a certain threshold. It basically has to show that your budget is continuing to grow and that you cannot be disproportionately cut. So if other town departments are cut, everybody has to be cut 5%. You can't cut the library 6% and the schools 2%, or something has to be cut. So there are various requirements that you have to meet for compliance. And then based on the size of your town, you get a proportion of state aid. So ours for this population is around 40,000.
Okay. And we're hitting all of that?
Yes,
Okay.
we well exceed.
Excellent. Excellent. That's all the questions I have. Thank you.
Hi. Hi, I'm Vincent Zhu. Nice to meet you. I'm looking at the summary sheet. Obviously, it looks like the supply, there's a big change from last year to this year. And you explain looks like it's because of the state mandatory about the material, purchase. What happened to last year? Should we have the same requirement of last year? So why last year was so low in terms of the material purchase?
Oh, no, I think this looks that way because I just moved them to different categories. Well, I only cut that,
Okay.
the materials line, I only cut it by 7,000.
Okay.
So I think the reason that line looks weird is because I
Yeah.
moved, originally, materials was in purchase of services, which it's
I
not
see.
at all a service, it's
I
very
see.
much a supply, so
I see. You
moved-
just moved from
Yes.
line 11 to 12.
Yes, exactly, so.
Oh, that's why you
If you
explained
go
it.
to expenses tab,
Yeah.
you can see
It's
how
a
she
little
kind of
bigger.
moved, like from one, it's like robbing Peter to pay Paul. So to
I
speak.
see. Got it. Okay. Thank you so much. Yeah. Another question, more a little bit general question. You are new to this town, and I'm sure you have some fresh ideas. And also, I feel like a library in terms of how it works along with technology development is changing, right? And I just was curious, what are the kind of new ideas you have like for a library?
Well, we were doing our strategic plan.
Mhm.
We had to start at we were 5 years out of a 5-year plan, so we
Okay.
started that. So I've been getting great feedback from the town, because
Yeah.
it's honestly really about what the town wants and needs, and not so much what I want to do. But one of the ideas, mostly technology-wise, was a makerspace. A lot of libraries have done those. They're kind of designated areas with technology that is often beyond the scope of what someone else could buy. It might be like a 3D printer or something like that.
Mm-hmm.
They're an investment, and a lot of times what keeps libraries from having those is space. One thing we do have is space. So I think that's kind of
Okay.
on my list, and I've gotten confirmation from patrons and surveys and focus
Yeah.
groups that they might be interested in that as well.
More technologies, basically.
More specific technology, kind of, that for patron use.
Yeah.
You
Yeah.
could have classes in there.
Yeah.
The other tricky part of that is having the staff to run it.
Yeah.
Someone who is knowledgeable enough with that technology
Yeah.
to use it and teach it and
Yeah.
be there.
Yeah.
So that's another hurdle.
One thing also on the book side, we actually expect in terms of book, the number of new books acquired. Is that the trending down?
No,
No?
it doesn't really trend down.
Really?
No, it
Okay.
hasn't really. Sometimes the numbers look a little funny because new materials cost, they're different formats,
Mhm.
right? So there's something called Playaways, which is like a single-use audiobook, or it's one audiobook on a little machine.
Yeah.
So sometimes we might start buying more of those and less of a different version, so it
Mm.
looks like we're buying fewer things, but they're more expensive, or they circulate differently. But generally, books, it's pretty pretty steady,
Okay,
pretty steady. They're still publishing quite a bit.
then that's all, thanks.
Hi, George Lee, nice to meet you. Welcome. A couple quick questions. I probably missed it because I was trying to get my spreadsheet open up. You meant 10,000 difference between the last year's budget and this upcoming?
10,000 over the guideline.
Over the guideline, I see, okay, gotcha. And then other question around the technology, besides the infrastructure, like the phone, internet, as you mentioned, can you explain a little bit more, what other technology that are user interfaced, or I guess, people that are actually using it at the library, that you see as outdated?
Fax machines, we have 2 faxes, we have a scanner, we have copier, we have printers that are solely for public use. We have a wireless one that we use specific software for so that people can actually request, they can upload the document, print from home, come in and get it. We have iPads, we have laptops, we have Chromebooks.
But I guess-
Some of that is
yeah.
being lent, some of that is people are borrowing those items, and some people are just using it in the building.
Yeah.
Plus the staff side of all of those, so staff PCs, staff laptops. We did just buy, we just installed a new projector system, an AV system and assisted listening system in our meeting room.
Do those have maintenance cycles on them to prevent them from breaking down, since they're out of date, I guess?
No, not that I'm aware of, that I've been able to find.
Okay. So I guess thought would be, like a printer, if they're out of date, if it works, it should be fine. But I hear the point, like the elevator, if you leave it for too long, then it breaks, and it ends up being very heavily expensive. They all happen to break down at the same time. So it'd be great to hear if if there's some sort of maintenance plan or.
That would be the plan. There's certain printers that we have replaced relatively recently that we would keep until their useful life is over.
Yeah.
But nothing is on a service contract that I'm aware of. So there are a couple things that are, but it's not consistent. It's not easy to manage. So I would like to get everything on one, all of the printers on one service contract, all of the computers. We've considered possibly contracting out to help us sort of set up a network. There is no Active Directory, which I've never experienced at a library. So we're really trying to start from the ground up a little bit.
So, just quickly, if you don't mind, are leasing agreements for technology way too expensive for something like?
No, not always. I have done lease agreements for printers and copiers before. I think that hasn't been done here. What I've seen here, which is kind of unusual, everyone has a printer. There are, I think, like 35 printers in the building because everyone has their own little, like almost like personal home printer. It's not efficient. We are paying an absolute fortune in like a million little toner containers. So the first order of business, I think, is one central big one. That not that it would get rid of all of them. We need a couple in the building, particularly for the public. But one kind of central larger machine, and I suspect we would lease that.
Thank you.
And, great question. But is that harmonized across the town? So where like maintenance could be carried, like some sort of maintenance contract that carries out all the technology within not just the library, but like the town hall,
Yeah.
where you can be more efficient and maybe some of the shared some of the costs, but then also obviously the greater amount of services, usually you kind of get greater discounts.
Greater discount, yeah. We did, in Wakefield, our main kind of large copier that everyone used was contracted through the town. So it's definitely possible, and it's certainly worth exploring.
The last one I was just around salaries. I guess, I mean, I know you're new, but is there a plan to, in the future, I guess, if you think the salary is not up to par, perhaps do some sort of, like more of a kind of a salary review, I guess? I don't know if there's like a library, but I know a lot of other sort of professions, there's kind of you can get somebody to kind of provide some sort of report that tells you, hey, for this particular role, the salary's up at par or not at par. I forget the name of that, but.
Yeah, it's like so they did a regrade here, I think a year or two years ago. The salaries themselves are very generous.
Sure.
It's not the, I think they're very, aside from like one category of people who I think might be miscategorized, but it's okay. But generally speaking, the salaries are very generous. It's not the problem, that's not the issue. It's that there's not enough people.
Gotcha,
It's
okay. All right.
Yeah, it's just
Okay.
there's not enough to cover additional
I
staff
see.
members.
Okay. Yeah, no, I thought I thought you had commented earlier about like comparing to Weston's budget and salaries being, being different.
It's just the total I was comparing,
I
so
see.
their salary budget, I think, is like 1.57 million or something like that. And so it's several $100,000 more than ours. It's not that they pay so much better, they have
More
lots more
staff, I
people.
see.
They have
Okay.
lots of people.
Understood. Go ahead. No other questions. Thank you. Thank you.
Hi, I'm Ben Thomas. Welcome to the town of Bedford. We're pleased to have you here. As you can tell, we're very much in love with our library.
Good.
So, most of the questions have been asked by now, so I'm pretty content with what I heard. I do have a specific question and a general question. Talk to me about security cameras.
We had 9 when I started. Again, it's a 34,000 square foot building. I installed 11 more to help with sight lines for staff who are alone in the building at night. It's a vast building, there are lots of places to be. It's not for surveillance of any more patron staff. Most people are not even looking at it, but it's helpful, particularly, for example, when the kids are in the mezzanine. We can kind of just look and say, okay, they're up there, it's fine, they're fine. We take privacy very, very seriously, so there is no angle at which you can be in a camera where we can see your phone, what you are reading, what you are checking out. It's really just to mitigate, we had somebody fall a little down the stairs yesterday. I was able to look back, kind of see what happened, make sure that there was nothing that, in the building that had caused them to fall. It's more for reasons like that. It's pretty standard, and in Wakefield we have 35 cameras in a much smaller building. I think often it just makes people feel a little bit less alone when they can sort of see what's around them.
I was going after no point in particular. I just wanted to understand where you saw the need and how it was working out. I assume with the additional cameras you have reasonable coverage at this
Oh,
point?
yeah, it's reasonable. I mean, there's always going to be stacks create many blind spots.
Yeah.
We don't need to see every inch of it. It's just to have a general sense of where people are in the building.
Okay, now I'm going to move on to my general question. I love it when we have new people start because they bring something invaluable. They bring a fresh set of eyes and a fresh understanding and ideas. So I can distill that down, I believe, into what did you find that was the greatest delight that you found, and what did you find that was greatest need here?
In the town specifically, I can say I have been absolutely delighted by the town staff. I have felt welcomed and included in town departments. That's not true everywhere. The library is often kind of off on its own. I've been delighted absolutely by the patrons. I've done now a focus group and read surveys. I've done, I created a strategic plan advisory committee of residents to help us kind of guide this strategic planning process. And everyone's enthusiasm and willingness to participate and just kind of share their feelings and be open to other people's ideas is absolutely incredible. And I have done this for a long time, and I have not encountered anything like the people in this town who work here and live here. And the second part, kind of, how did you phrase that? I want to make sure I'm...
What's the biggest need?
The biggest need?
And you must have looked at what's going on and said, this is good, this is okay, this is neutral. Oh boy, I got to fix this.
I mean, the biggest need in the library is honestly staffing. It's hard to meet the needs of the town. I'm going to these meetings and people are like, we want programming and we want this, and these are all things libraries should provide. Programming, services, readers advisory, book groups, all of these things. I just don't have the people to do it. I'm trying to just kind of keep the doors open right now, and because we've had some turnover, a bunch of people naturally just kind of retired. It was just timing. Other people have just moved around. The staffing is the biggest need.
So I'm not trying to play gotcha, but didn't you say a few minutes ago that the need was people, not salaries?
Yes, it's still people. Yes,
Okay.
there's not enough
So
people.
you just can't find enough people to do the jobs that you need done?
No, I can't. I don't have the money to pay them. I mean, it's not the dollar amount, it's
Okay.
the total, like I don't have the budget for another
Okay.
person.
That's what I was trying to drive.
Sorry, yeah, it's not.
I don't want to put words in your mouth.
The salaries themselves, like the hourly rates and
Yeah.
people's salaries are absolutely adequate. Like they're very, very generous. That's not the issue. I just don't have enough to get more people. I probably, like I said, in a perfect world, I'd have at least 2 more full-time people. And probably a handful more part-time.
Question. George?
Everybody loves the library, and you know, like for example, like the front desk. Have you had experience in other libraries that maybe they have like a volunteer program or some sort of senior program where they come in and help out a couple hours, either at the front desk or something that doesn't necessarily require like librarian skill sets per se?
I've only worked in union libraries where that would not have been kosher.
Okay.
The front desk is fairly skilled, the computer systems. There's a reasonable number of policies that you have to follow. It's not super straightforward necessarily. It's not that like you do teach, there's training you need. We have a lot of volunteers actually. They just can only do so much. It's the librarian positions that I'm needing, the professional master's degree librarians that are kind of more the need. We're actually okay at the desk and with shelving and things like that. We have papers and things that we help have for that.
I do have one more question. Since we're short of money, is it possible we can lease out some of the facility, something to to whoever needs the library space or equipment to get additional income?
Typically, I would have to look. Part of the kind of joy and beauty of the library is that it's free.
I know.
And so I think we would, I mean, you can, for example, like the Boston Public Library, you can get married there. It costs several $100,000.
Yeah.
But there's also liability involved in that. There's, they incur costs by having to do that.
Yeah.
I don't know that we have the capacity at this moment to consider it. We allow the use of our meeting rooms for free. You only have to pay a custodian if you're in our big room past 9 o'clock. But, I don't know if that would be outside the spirit of the building.
Just an idea.
Yeah.
Thanks.
Anyone else have any further questions? Okay, thank you.
Thank you.
Thank you, Jay.
Thank you.
It's nice meeting you all.
Nice meeting you.
Nice meeting you.
And as I promised Heidi, now.
So Heidi should be online, can we see?
Yeah,
I don't know if you were sharing your screen.
we were not.
Yeah, there she is.
Heidi, can you hear us?
I certainly can. Hi, how are you all?
Good, welcome.
Thank you. I appreciate you accommodating my need to be remote. Do you have the opportunity to put my screen up?
I can put up anything that's in Dropbox. You should be able to share. Let me promote you to a panelist, sorry.
Thank you, appreciate that. Makes me feel a little bit more part of the meeting.
Yeah.
So yeah, I'm here tonight, well, you're there tonight with Dee Bronkhorst, our Board of Health Chair. I am remote, I've been under the weather for several days now. But I wanted to be here with you tonight to present our health budget, which is under the guideline, as you hopefully can see on a screen or in your packets. Can just talk a little bit about a few little shifts in our budget from this year in that, I mean, clearly our salaries take up the majority of our budget and we were already at the limit with that. But we did do a little shiftaroo with regard to our in and out of state travel. We pulled our conference that used to be out of state is now in state, so in order to be clean with our budget each year, we just pulled those funds into the in-state travel number. That's a significant part of the health budget. And this year also, instead of the hazardous waste and mosquito control budgets being under the select board, being a select board budget but managed by the health department, the finance director has pulled them into the health budget in addition to adding the line item for the CERT team under our supplies line items categories as well. So with the addition of the hazardous waste and the mosquito control, that obviously adjusts our overall percentages. And we did indeed need a bit of an increase, a small increase in our hazardous waste removal services budget. That budget, not only does it accommodate 8 events where residents of Bedford can go sign up and then go over to the Lexington landfill, which is we're part of that 9 community collaborative, the Minuteman Household Hazardous Products Collaborative. So there's 8 events annually, but this budget, this line item also accommodates our kiosks around town that that we have for collection of sharps, medical sharps, as well as prescription drugs, and that service line has seen a particular uptick in need this year. We've had full kiosks and had to accommodate more frequent emptying of the kiosks. Probably also impacted by the increase in use of the GLP-1 injectables as well, because those tend to take up a lot more space. We'll see what happens next year with regard to the increase, or maybe the uptick of the pill versus the shot. But still, we just had more of a need for that particular service line. So we have that little bit of increase in that line item. The board, this year, you see, I'm sure you've seen the health accomplishments that we've had. We've had still having really great success within the health department with our vaccine clinics, conducting 20 vaccine clinics this past season. We did launch our naloxone program this year, which is the Narcan. We set up a bunch of free distribution boxes, and we have worked with our CERT team to make sure that those are replenished on a regular basis. We're really encouraging folks to have naloxone as part of their personal first aid kits. Not if you use, or if you're in a family, in a relationship or in a family with folks, or friendship with people who do use, but just to have it in the event that you are with someone who is undergoing in the middle of an overdose, to have it available on your person or in your car. We're really encouraging that. And we've actually launched our opioid use survey, and the community outreach to the community for folks within the community to help us decide, to actually decide and to help inform us of how they would want our opioid settlement funds to be spent. So that survey has wrapped up now, and our regional coordinator is digesting that data for us, and we hope to even have some presentations in the coming months on that, and then roll out some additional programming relative to that. But the Board of Health this year, they revised their biosafety regulation, had a couple of gun buyback programs from a regional perspective, which is super successful, whereby we collect unused firearms and are able to distribute gift cards to residents who do surrender those firearms. We had a really successful workshop on addressing grief within our community. We've had several events within the community regionally, and just things that are going on nationwide that are affecting people. So we had this really fantastic workshop on grief with our partner, Edinburgh, the Edinburgh Center, who's now working with us on the youth and family side. But they helped us with this workshop, really well received. It's online. I encourage folks to take a look at it if they didn't get a chance to attend. The Board of Health also has done quite a bit of work with regard to mosquito and tick outreach, tick bite prevention outreach, of course. And we have a really, as you saw from the budget, a really robust mosquito control program. The board also was supportive of the school department looking at the school sleep times and being a part of that evaluation as to whether or not the schools could adjust start times in schools to accommodate for more sleep for the students. We have significantly, as we got last year, a little bit of a budget for CERT support. The CERT team is tremendously supportive of our not only health department activities, but townwide activities through the food bank as well, and other immersion in they're ready in an emergency, but they're utilized throughout the year for non-emergency events. The number of hours that they participate in town equals about a person and a half with regard to the support, and that's like that's just super amazing. They're a really great group of well-trained and eager and ready to respond folks. And And then most recently, the Board of Health co-sponsored an air quality seminar with outlining presenting the data from Dr. Huda, who had done some air analysis downwind of Hanscom Airfield. I think I'll leave there. I'm obviously open to taking any questions or have any comments or considerations relative to our budget. And of course, Bee's there as well. I didn't know if Bee had anything to add on.
Yeah, thanks, Heidi, that was great. One thing that Heidi has been very, really great to do since 2011 is to, I think you have it, you know, there's like 8 pages of describing all the grants that she has been able to bring in services, and then also tallying up all the volunteer hours, you know, and how that has helped run the health department, and you know how it has augmented our ability to provide services to the town.
And has had an impact on your budget requests these last 15 years. No, I'm serious. You guys put the effort in.
Yeah, yeah.
People and money, and it's noticed. And I want to say thank you for that.
Yeah, and she's great at doing that, and also bringing interns in. I'll never forget during COVID, we had interns who really helped us out so much doing all that tracing, that contact tracing stuff. And a lot of other boards of health couldn't do it. So we were very, very fortunate to have that kind of network.
You have a great board.
So, and we've had interns since then as well do some good projects.
Yeah, I mean, outside of, just to tag on to that, Bee, just because I would really like to just mention the fact that HHS, the Health and Human Services Department as a whole, encompasses the Youth and Family Services Department. We're not here to talk about that budget tonight, but we've regularly had social work interns through that department. And just to plug the fact that they were instrumental in response to the very unfortunate passing of this Bedford Public Schools student who passed away with the e-bike incident. But in the days and weeks following that, not only did the Youth and Family Services team, but a cadre of their interns, as well as interns through the Edinburgh Center, again mentioning our partners at the Edinburgh Center, were able to provide a really robust and well-received support to the schools. Whereas the counselors were supporting the kids, our team was able to support the staff and school and teachers within the three predominantly impacted schools. So the value of building those and having those relationships built and continuing to perpetuate them has really proven to be, I mean, tremendous. I mean, we really couldn't do the work that we do to the extent that we do it without them. So thanks to you for those great words and for them, you know, reminding us all of that.
Yeah.
Are you set?
Yeah.
Karen, you want to start?
Sure, thank you, Heidi and Bee, thank you for being here. It's great to see all the work that, I understand all the work that is behind the grants. That's really impressive. It's great to see how much that's like softened the budget, really impressive. And I'm wondering what you're thinking is the biggest pressure right now. Where you, like you guys seem to see around corners and like what's coming and what we might want to prepare for, and what's on your radar?
I think, you know, something that's really, well, it's not having a rearing its ugly head, but it has been around for quite a while, are tick-borne illnesses. And I think we're seeing a lot different types of illnesses coming, of viruses and bacterium coming our way. We've done I think we've done a pretty good job, or I think a good job of doing, providing outreach in various, from various avenues where we have, you know, we've identified tick environments at trailheads and trying to remind folks of that, trying to remind folks to do tick tests and tick checks and wear bug spray, and thinking about all different ways of doing it. But I think that these diseases can be very, very impactful to families, to individuals, and I think with climate change, I think with environmental changes, I think that we're going to see a lot more of it. So we're going to be concentrated on doing a lot more education and and environmental impact outreach as much as we can on that particular topic.
Thank you for that. And one last question. Thank you for, being cognizant of the guideline and managing everything. Where are you feeling the most pressure there in terms of keeping the budget the way you have here?
Predominantly, I mean, at this point in the game, it's technology and software, and then I would say staffing. We are a very small department, and we get by with a lot. Currently, we can get by because we have this fantastic regional collaborative that we've become a part of over the past several years. The Great Meadows Collaborative. We're now on I think we're on year 4, and we're in the middle of year 5. I think, from that collaborative, we do have access to some staffing. For instance, we've been down a staff member. We're a 4-person department, and we've been down a staff member for 3 months now. And through that collaborative, we've been able to have some staff members come in and at least fill in a couple of days a week. Through that collaborative, we've also had, and the collaborative is supported by federal and state grant funds. So we've had access to some really fantastic housing software, and really enabling us to be more efficient at our housing and particular hoarding inspections, because we've had a huge uptick in that realm. So the consideration is really that if that funding and that access to those staff members went away, we would be in trouble, and we would need to do some probably fancy footwork to figure out how we could at least maintain a baseline until we could get some funding to keep that programming afloat. I think I know we would have heads up on that, so we would have some time to figure out how we would accommodate that. But the influx of those funds from a regional perspective has been tremendously beneficial to the department.
Thank you. I'm all set. Thanks a lot.
Mark?
Thank you. Thanks, Karen.
Thanks so much, Heidi. I thank you in particular for the work on grief and the work you just mentioned in terms of supporting the teachers in schools after the death of Parker Robles. The response at JGMS to that was world class, and knowing that you were kind of under that and supporting that is wonderful. I would also join those in the community who have already thanked you for the Narcan program. That's dear to me. You mentioned that there's been a few kind of drop-ins and people stocking up and encouraging people to keep it in their kits. Do you have any data on actual use on when we think of the worst case scenarios that's there for? I know we're not always in a position to know how what is given out is used, but do we have any data on lives saved or actual use over whatever duration we measure?
Yeah, we don't at the health department specifically, Mark, but I think we could do a deep dive with some data from the police department and from our 911 calls, especially knowing when it is deployed, when someone is actually administered Narcan. We could know that. Again, whether it's ours or not, we wouldn't know that. But again, we continue to be encouraged with the fact that every time our CERT team goes out to do the replenishment, that they're filling at least a few containers, a few boxes in our containers. So it's getting into the community for sure.
Awesome. And you mentioned the hoarding support. I know that's been a pretty heavy focus for a few years now. Can you quantify the number of residents that have been supported and enabled to remain in the community where without the program out of?
Yeah, certainly. I'm thinking, just in kind of counting them in my head right now, I know we have we have 6 active cases right now. Yeah. And by active, when we have a regular, I shouldn't say regular, but a typical housing related case, it should only be on the books for 30 days. That's what the code actually calls for. You have to wrap up and make all your corrections in 30 days or we go to court. We essentially establish a contract with our residents who are involved with hoarding related disorder or hoarding related circumstances, whereby as long as you continue to make progress, we will not be going down that route with you. We're going to provide you with supports. We also have a buried in treasures group that we encourage folks to participate in. And then for longer term supports, we have just a clutters group that meets on a monthly basis with the support of our social work team. So there's a bunch of different mechanisms that people can receive support from our Health and Human Services Department. But these cases, the hoarding cases, even though they're few, they're very, very involved and very time consuming, as I'm sure you can imagine, because we're going back on a regular basis to ensure that progress is indeed being made.
Okay, thank you, Heidi.
Thank you.
So, Al?
Just a big thank you for all your work and all you've done. Both of you, thank you.
No, same thing here, no questions, but I appreciate the work you do.
Thank you.
Bill?
Yeah, I think just a couple things. Thank you first of all for kind of your focus on the budget year over year and being able to come in within the guideline year over year. So it's very appreciative and makes our life a little bit easier here. In terms of that, the fact that you have a 0% increase for expenses and then mosquito control, I imagine with pricing pressures year over year, creates some challenges. I'm just wondering if you have any concerns with that from a perspective of lost service, or do you think you'll be able to manage that pretty effectively, just kind of
Yeah, that's not a line item that I'm just setting at zero. I consult with our mosquito control contractor, East Middlesex. We're part of a large collaborative of professionals who provide these services for us. And we did a deep dive into looking at the history of what our weather's been looking like over the past several years, what our winter has looked like, what our winter looked like last year, and how wet our summer was this past summer. To recognize the fact that at least for next year, we're not going to need the level of services. It's predicted that we won't need the level of services that we needed last year. There's a little bit of a cushion in the mosquito budget in that there's a line item for ditch maintenance, and if those services, and that's to clear out small brooks and ditches that to ensure that water is flowing and not stagnating, because stagnant water, as I'm sure you can understand, could allow for mosquitoes to breed and grow and for their eggs to grow and the larvae to grow. So when there's that bit of money can carry over within the state budget the way that it works a little bit from year to year. So we have that small little bit of cushion. So should we need to pull on that in this year or in a future year. But as far as the actual surveillance, the traps, the laboratory analysis of the mosquitoes that we collect, the budget that's been put forward for this year has been deemed to be, by our contractor, by our professional, to be sufficient.
Excellent, thank you. And then the one final thing is just probably not for this year, but looking kind of for years out, with the reductions in federal funding for grants and so forth, particularly through the HHS department, do you have concerns about lost services with some of the grants that you've been getting? And basically the question behind the question is more, do you think there's going to be need for increased town funding to support kind of commensurate loss of grants over the next few years to manage services?
Yeah, I would say the grants that we've received as of late have been sort of add-ons. We have currently an FDA grant for I think it's on the budget there for $8,500 this year. That we acquired because we're looking to go through a standardization program, a standardization process in our small budget, in our small department. I mean, as you understand, outside of Massachusetts, outside of Massachusetts, local government is county government, right? Everything is run on a county basis. So colleagues in other states are going through the standardization process for their food protection program, like restaurant inspections and ensuring that restaurants are up to par. They do it on a county basis. We're doing it in Bedford on a local basis. We're doing it here in Bedford. So again, an add-on service that we have our food consultant working with us on. So should that money go away, we won't be standardized across, in accordance with the federal standard, but we're still meeting state standards, we're still meeting food quality, safety requirements and everything. It's just not getting to that extra level. We're overachievers, we want to go above and beyond. if that money went away, we would, you know, yeah, we would probably be on pause for a little bit of time, but I'm sure we would figure out a way to get, you know, to finish off our other project that we have at hand. The second part of it is, I mean, we had a little bit of a struggle this year with our vaccination clinics, right? You may have noticed that we did mostly flu vaccine this year because we were going to have trouble, first of all, getting access to COVID vaccine. Secondly, we were in a little bit of limbo with regard to whether or not we were going to be reimbursed because you know, they weren't reimbursing for, we were necessarily going to be reimbursed. If an insurance company had its headquarters outside of Massachusetts, we may not have been reimbursed for that vaccine if we had administered it, and if the resident that we administered it to had an insurance outside of Massachusetts. Now, the governor rectified that pretty quickly, so we were able to continue to launch our program. But it did have us, you know, have to pause for a little bit of time. So if we still have to go through that back and forth, I mean, our vaccination program is a reimbursement program. Like, we are able to purchase that, we have a revolving account for that, as I'm sure you know. We charge residents for the vaccine and for the administration of the vaccine, and we put that money into our account, and we purchase vaccine, and we pay vaccinators the very next year. So it's an in and out, but if we have trouble with being able to get those reimbursements, it's going to definitely impact our program.
Helpful, thank you. And thank you for all you do.
Thank you.
Heidi, I just have a quick question. You mentioned about Bedford Opioid Settlement Fund. Just curious, do you know how much of the amount that is?
We have over 200,000 right now
How much?
in our account. 200,000.
200,000. Okay.
Yeah. And so, you know, some of these smaller programs that we've done with the Narcan and Narcan boxes, et cetera, we've done some community outreach, we've done some focus groups relative to to determine, you know, how we're going to spend the money. That's why we need to gather that information, because part of the requirement of receiving these funds is to ensure that we are administering and distributing them in accordance with how our residents want them to be used. So again, hopefully you'll see some really great data coming out of this in the next month or two, and be able to, you know, continue to roll out our programming. Whether that's, you know, supporting folks with transportation to accessing treatment, whether it's more upstream preventative programming, whether we're in the schools, whether we do more talks, whether we have more youth programming. Anxious to see what some of those results end up informing on, and you'll be seeing I think you'll be seeing some really great outcomes from that.
And maybe it's worth to mention that through the collaborative, we've been able to hire a outreach coordinator, or what is her title?
She's a substance use prevention coordinator.
Substance use coordinator.
We some of our opioid prevention funding, opioid settlement funding is utilized to pay a portion of her salary. We're a member of a 7 community collaborative, our Great Meadows Collaborative, and she's an employee of that collaborative that we help to support her salary.
Great.
Thank you, Bea, for mentioning that.
Yeah. So that's how we're doing it, and I think that's really great to have it over the 7 communities.
Yeah.
Because you get more bang for your buck.
That's right. Okay, that's my question.
Well, thanks for coming in. Thanks for the great budget, and obviously, as Karen mentioned, for being within the guidelines. Well, Vincent was just on the topic of substance abuse. One question just kind of popped up in my head is, do we know if there's any vaping issues within the school system in Bedford?
Vaping?
Yeah.
Yes, maybe Heidi, you want to talk about that?
Oh yeah, there's vaping issues for sure. In the high school, going back a couple years ago, we got a grant for installation of some vaping detectors, and basically it looks like a little smoke detector. Actually detects not only vapors, but also motion. So if there's like a scuffle in a bathroom, it can alert. It sends a message through an app to the assistant principal to respond. But I know we applied through the school. We supported the schools in applying for another grant this year to extend that program into the middle school. We are seeing it at the middle school level as well. We don't, and through the Youth and Family Services Department, we do offer a diversion program. So if kids are identified are found to have been vaping, in lieu of, I believe it's in lieu of whatever the punishment is in the handbook, whether it would be a suspension or whatever the case may be. They have an opportunity to attend this education program. It's a 3-session education program with our youth services coordinator, Mallory Fuller, who goes through a programming with them in education and et cetera. So I haven't heard actually whether, something I need to probably follow up on is whether or not the schools got that grant. But there's definitely a vaping issue within the schools.
I mean, is there an opportunity to have vaping education, just, you know, in general within the maybe health curriculum versus only providing the education after they get caught?
Yeah, that's a real question for the schools. We can definitely follow up on that. I mean, I know that their curricula, their time is really tight, and I would imagine that within the health curriculum within the schools, that they do offer that. I'd be surprised if they didn't, to tell you the truth. It's, you know, as opposed, you know, doing it, like, as we mentioned before, upstream versus downstream. I do know that we cannot use the opioid funds for those vape detectors and for vaping related items. It's kind of an odd thing. You'd think, I tried to put it forward to get funding to purchase the vape detectors with the opioid funds and was turned down because the vape detectors are actually shown to not be evidence-based, in that they're not necessarily a deterrent, whereas unless they're done in conjunction with education. So, and even then, it's not really considered to be evidence-based. And those that are overseeing the use of the opioid funds are very, very interested in evidence-based outreach and programming.
It'll be great if, you know, if there's a chance to follow up with the school on any vaping education.
Oh, yeah.
Kind of as a proactive means versus retrospective, that'd be great. The other thing I have is, as I attended one of your prior Board of Health meetings, you guys had that particular air quality research that Heidi also mentioned.
Yeah.
I know you guys didn't come to a conclusion on kind of next steps, but any further discussion?
So we've been, we had another meeting with Dr. Huda, actually more community based last week. And there's a lot of strong proponents in town. Mothers Out Front, League of Women Voters, the Stop Jet expansion now. Everyone is very anxious to, you know, see what is the next steps. And actually, we had people there who are part of those community airport.
Massport has a community advisory committee, and it's called either MCAC or MCAC. It's kind of a horrible acronym. But I'm the actual Bedford representative to MCAC. As there's obviously others. So any community that's impacted by Massport action has a representative on this committee. And this advisory committee, yes. And the advisory committee actually receives funding from Massport on an annual basis, the majority of which tends to go towards the staffing. But there's other opportunity for the advisory committee to support community-based initiatives that if there's an application, you know, made to them. So I believe I wasn't able to attend that last meeting, but I believe Erin Toffler, who's the executive director for MCAC, was there. And I know that my colleagues from, my fellow MCAC representatives from Lexington, Lincoln, and Concord are meeting in the short term to decide some next steps as to whether or not an actual proposal will be made, likely an actual proposal will be made to the MCAC to ask for funding for further evaluation.
That's great, because it pretty much is to buy sensors, the ultrafine particle sensors, and then also to fund being able to see what the numbers are and analyze them and you know, all that.
Oh.
So, yeah.
Oh, no, that's good to hear. Yeah, I was going to suggest that, you know, maybe we can work with other towns in collaborative if there's a budget need to kind of further enhance the project, but it sounds like there's a way to actually get the funding without having the town people, so that's fantastic.
That's right. So I'm very hopeful with that potential that we'll be able to do that. Because I think Dr. Huda's, one of the big things that her first analysis showed was that Bedford is very much downwind. And it's just because, you know, it comes from the west, right? Goes to east, the wind. And so I think potential for more ultrafine particles coming our way is there, you know? It's a big potential. So, and it's air pollution, and I think air pollution, definitely ultrafine particles has been shown, you know, it causes cancers, it causes asthma, you know, respiratory, many things. And I think it's underappreciated, air pollution, the role it plays in health in general. So I'm thrilled that it seems that we have a way forward.
Yeah, no, that's great. Hopefully we get the funding
Yeah.
and more research can be done. Great.
Yeah.
Thanks so much.
So as usual, Heidi and B, you've done a fantastic job. We rely upon you to actually show the way.
I'm sorry, I can't hear you.
I said, we rely upon you to show the way. As we've said, you bring in grants, you bring in money, you do creative things with interns, you reach out to other people around the state, you do a fantastic job. So pretty
Oh,
much,
thank you.
I don't have any questions other than a personal curiosity question. I know we
What's
measured,
that?
ticks bug me to death. And I know mosquitoes are the same thing. I know the state does some, or county, I don't know which it is, does some monitoring of a number of triple E infected mosquitoes get caught. Are we monitoring anything with ticks like alpha-gal, Rocky Mountain spotted fever? I mean, Lyme disease is the star of the show there, but alpha-gal is bad news for the rest of your life, so.
Yeah, I mean, there's no statewide or countywide program to do that. We've talked about like expanding the services of our mosquito control contractors to determine whether or not they could do some testing. That's again something we have done in the past. I mean, many moons ago, in my early years here, we had a small grant or a small bit of money, and we were able to just do some flagging of some really heavy tick areas within the community. And it was more of a numbers count versus we didn't have the funding for an evaluation and analysis. Definitely needs to be looked at more. We are seeing alpha-gal, we are seeing, not just in Bedford, I'm not saying in Bedford specifically, but in this region, we are seeing Powassan, Rocky Mountain spotted fever. And I think we know that Lyme has been here for decades. So again, that's why I really went, you know, when Karen asked the question about like what's next, I'm like that's really what's really going to be a heavy focus is making people aware of the fact that like it's not just like a fever that kind of lingers with you for a bit of time. These can be deadly diseases. Not to be, you know, so like alarmist about it, but I think we need to just make sure that folks are taking the necessary precautions, not being cavalier, ensuring that they're staying. We want them to enjoy the outdoors. We want them to go on the trails, but stay in the middle of the trail. Don't let your dog, you know, roam into the heavy brush and then come home and have to, you know, worry about whether or not there's a tick that came in on them. So that's on us to do that education. We've done a pretty good job over the past several years on that. We have a brochure about how to landscape your backyard to prevent tick environments. But I feel like, you know, we don't know how many people have actually acquired these tick-borne illnesses because oftentimes docs don't actually test for them. They just treat you for what seems like it could have been a tick bite.
Right.
So we don't get that data that comes in through our regular surveillance system. So I have to think of I think you're right, some sort of innovative ways of thinking about some next steps or a little bit more an in-depth way of evaluating what the conditions are within our community.
Also, another huge vector is the deer population, right?
Absolutely,
Yes.
yeah, absolutely.
And, you know,
Deer.
we need a state, county-wide fix there. I mean, deer don't know borders.
Right, no, I understand.
And, you know, I mean, we were shocked, I mean, recently we got some numbers of saying that there's so many deer here, even reducing them by like 10% wouldn't even touch it.
No, the deer are like,
You know, you'd have to really.
They'll just fill in, you know, if you remove them, they'll just fill in, they'll
Right.
backfill in.
Yeah, that's right. So we just need more, yeah.
the thing that brought it to my mind was I am just stunned by the people I see out on some of the town's trails. Town's got beautiful trails, but I'm out there with physical and chemical barriers on because I've gotten enough ticks on me for a lifetime. I don't want any more, and I see people out there just wandering around in shorts and a t-shirt with sandals and, you know, humming away that the ticks won't get them. It's like, no, they're gonna win in the end.
Yeah,
So
definitely education is a huge component.
that's why I wondered if you've done any measuring to, basically literally scare people
Well,
a little bit.
I think, you know, like Heidi said, we had that grant early on, but, you know, we need, I think, more significant funding to fund the actual analysis.
I just was wondering, well, yes, I agree completely. Some of it is also just, is incidence increasing? As it gets warmer out, is the incidence increasing? Do we see more alpha gals? Do we see more?
Yeah, oh yeah, babesiosis.
Right.
Ooh,
Yeah.
So there's another one.
yeah.
The list grows even while we're sitting here. Okay, thank you. I was curious if you measured that.
Actually, one follow-up on that. So are there studies done to proper control deer populations? If your comment was that you remove them, that they just fill back in, like?
Yeah, I mean, it's complicated. Weston actually did culling, and I think they might continue to do the culling. There are services that, you know, can be employed. I've heard in other states that they do that. But again, I really feel like you need to do it on a countywide way. And there are companies out there that are actually active in Massachusetts that will take the deer and provide the meat to local
Yep.
food banks. So.
But again,
yeah.
we've been advised by the Mass Wildlife that like, if you cull deer and you remove them from an area, they will come
They will
back.
just
They
come
will
back,
have
right.
you'd be helping Lincoln and Concord get rid of their deer because they're gonna come to
That's right, so that's why
So-
a regional solution
A
is the
regional,
only way.
exactly.
That's true on so many
Exactly.
things that we deal
Yeah,
with.
it's
Regional-
fascinating. The whole ecosystem is fascinating between the red-tailed bunnies, the deer, I mean.
The mice.
Mice, exactly. So it's like, exactly, there's so many
Mice.
different components to the whole tick control.
If we could only teach them how to read town boundary signs, we'd have it made.
Right. And then the mosquitoes.
Anyone have any more questions? As always, thank you. Very good job.
Thank you.
Thank you very
Thanks,
much.
Thank you. Thank you.
Thank you.
Later.
Did you need me to sign in on anything, or are you? No. You don't sign in. Okay, we know you were here.
Like this next one.
This is the time.
Is that the mic?
The owl.
That's the
Yeah.
owl,
would so.
which is a mobile mic, effectively.
It's not swiveling. You got a speaker system and cord sticking.
Do you want the presentation up on the big screen?
Yes. You can put it in slide mode. You can find the proper button.
I don't even know what app it's opened. It's opened as a PDF.
just ended up, you put it as a PDF, so.
Oh, it's only a PDF?
Slide by slide, yeah.
Oh, so you'll have to scroll. Okay, I'd like to introduce myself. I'm Craig Jackson, 5 Richard Road, a member of, chair of the Capital Expenditure Committee this year. Been here 45 years. I know something about that. And there's a site, this is the list of our members. New this year was Vincent as the Finance Committee liaison, as well as Terrence Parker as the Select Board liaison. And I want to thank the diligent effort of Amy Fidalgo and the department heads who presented the budget to them. The real work all came through the department heads, because Amy was very good in telling them how much money was available and don't go over it. I simplify. Okay, go to the next slide. We met through the fall to review with department heads and other support staff to review presentation, the budgets, and discuss presentations with included IT, public safety, DPW, facilities and schools. And we had, this is all virtual because we find it's easier to go through slide decks virtually. And then met in person wants to prioritize actually vote on it. We also received preliminary information on what's coming down in the capital, CPA capital projects as part of the DPW facilities presentations. Now, this, we don't vote on, we get presented CPA projects, but we don't actually, we can vote on them. We have not done so this year. We would have to meet again to read it because they're just now running through and they actually have a slightly larger list than what we saw.
And that's in an advisory capacity to CPC?
Yes. And that's being discussed whether, right now in some of these bylaw changes to clarify that role and what role we have in that area. It's a little complicated.
It's mostly a big fat wall.
Yeah. Well, no, they just said, they wanted to clarify that we don't have to vote on them. You still can if we're still citizens. I wanted to say that we voted to recommend all the projects that were presented. And that's partially because of the nature of things, and this has been true since capital expenditures have had the form that it's had in for about 30 years. If the budget needs to be adjusted, you generally don't eliminate a whole lot. You take this, you reduce the size of individual items. And that's what we did last year. We eliminated a couple items, but we reduced the size of many items. And the proposed budget is $6,785,700, and we were given a guideline of $7 million. And this number is a 47% less than last year's budget of $12,760,500. We were fortunate in reaching this number because we had good news on the high school boilers, which when we get to the facilities.
Before you move on, there's a question that Amy knows this question. Is this going to keep us below 50% spend of free cash?
Based off of the estimates that you are all using right now in the model.
Okay, thank you.
Okay, go ahead, next one. Okay, this is the Department of Public Works. The biggest item in the DPW budget this year is an upgrade to the Carlisle Road pump station. We only have to do one pump station a year because they last about 30 years and we have 30 of them. This year is sort of slightly taken out of where I think we'll be upgrading capacity of the pump station at 108 Carlisle Road to take into account the new Carlisle Road development. And this is part of an agreement with the developer where we cover half of that cost. And the developer covers the other half. And per the agreement, work will not start until the developer's portion has been received. The large equipment, large DPW equipment is separated out into separate items. This year, we're buying a front-end loader at $210,000 and a large mower at $160,000. The front-end loader is 17 years old, and that's exceeded its useful life, and that's one of two owned by the town. The large mower is a little more interesting. It's the primary mower for all large tracts of grass. It's most likely the mower you will have seen around town. It has an attachment for mowing brush on the side of the roads, which as a cyclist I very much appreciate. This is a 2019 unit that was supposed to last 10 years, but this unit is incurring increased maintenance costs due to its heavy use, so we requested to replace it. I don't recall if we asked whether the new one's supposed to last more. I come up with new questions every time I look over it. And certainly you probably
We know the problem.
The sidewalk municipal hardscape improvements is covering the portions of the town common project which cannot be used for, are ineligible for CPA money. This is mostly proposed sidewalks on Elm Street and South Road. CPA funds cannot be used for sidewalks. And the space for the sidewalks will be created as part of renovating fences. The stormwater permit requirements is just an EPA mandated program to address stormwater issues, including the town's stormwater storm sewer system permit. And this funds a consultant and it also funds minor projects within the year, replacing one catch basin that's overflowing. The stormwater color drainage repairs is an ongoing thing. This is like the third year we've had it. They've started since we had so much rain in 2023. And it's addressing flooding issues in town. And the work this year is to replace the Mongo Brook culvert under Fern Way, based on design work in FY26. And this is upstream of the Richard Road culvert that was done in FY25. Incidentally, the front door. Well, right on, part of the working we call replacement driveway. Now, there's a town property rehabilitation item. The DPW has requested that a new continuing recurring item to be added to address certain maintenance issues that are generally aren't covered by other. They're not covered in other places in the budget. And in particular, this year, one is replaces sidewalks, fire lanes, the basketball court, drainage, and some parking at the rear of Lane School. And if you look at here, the part in blue on that thing is the area that's being done. And I got a question from the select board. Is parking lot looks fine to me. It's not the parking lot that you're seeing. It's not the part of the property that you just see from driving up to the front door. There's issues in back with drainage and cracked pavement. Now go to the next slide. Oh,
What's transportation improvements?
transportation improvements. Yes, this is sort of a standard minimum allocation to or basic allocation to cover the traffic calming policy. Existing projects in traffic calming include Dunstable Road and Hemlock Lane. Fund small projects. For example, I think this year there's a proposal this year to put a RRFB flashing yellow lights at the Concord Road crossing of the Reformatory Branch Trail, and I believe is that under this budget?
We are also doing a second phase of traffic calming on Johnston Road. We did the first phase in this current fiscal year, and it didn't quite accomplish the full level of traffic calming that we wanted, so we're going to do another phase.
And this all fits in $50,000?
It does for local neighborhood traffic calming.
Okay.
The other reason why this is such a small amount is because we do have a turn back from a previous transportation project that we can put towards a much larger scale level of transportation improvements, given all of the accidents, pedestrian needs that we're seeing. So just to make it clear, this number would have been much larger had we not had a previous contract that came in under budget.
Okay, thank you.
Go to the next slide, please. Okay, the town routinely, under vehicle replacement, the town routinely tracks the age of all of its vehicles, and this is under the DPW budget. And the DPW purchases and maintains the police cars, typically. Fire department separate. This year's employee request includes 2 hybrid police cruisers, I think they're all hybrids now, a small dump truck, and a specialized truck used by the sewer division. And then if things come under budget and there's extra money, they might replace an electric van that's used by facilities. Water main improvement program is an ongoing project. They try to maybe upgrade some piece of the water mains every year. This year will be Springs Road between the VA and Hoover Road. And then the water meter replacement program is actually sort of, I thought, was one of the coolest things that I learned about this year is it continues to roll out what's called advanced metering infrastructure in their jargon. And that's a product that allows the water meters that the radio, that they, a number of years ago, well, it seems not like too long ago, an old guy like me, but they replaced all the meters, the water meters, so they could be read by
Yeah,
a car.
we replaced every meter in town.
Right. Well, now they can have it so that those same meters can be read remotely by like a system. They've already started I think a system stuck on top of the Pine Hill Road water tower covered a significant portion of the town, and now they're going to put these transponders at other locations in town to cover. I think they said, what did you say, 96% or 94% eventually?
A little bit under that, but yes.
Yeah.
And the majority of the town can be covered through the Pine Hill location.
Correct. And this is something that, that by doing this, they don't have to have a guy an employee drive around the town reading those meters, and so they can read them essentially as often as they would like. We've discussed making the usage information available to homeowners on a website and using it to detect leaks in a much more timely way. This also considers, this item also includes other maintenance of the water infrastructure such as water lines. And then the water standpipe rehabilitation number is sort of the standard who inspects and it's a consultant about the state of the water towers. We had a bigger number last year, but this is just basically.
It should be in pretty good shape. They
Yeah,
rehabbed
I
not
think
that long ago.
we've done, I can't describe what the work was done, because that's last year. But we've redone them several. And the next slide, please. For the facilities of town work, first of all town buildings flooring, the flooring in the town buildings just needs to be updated periodically. The focus this year is going to be on town hall, town center, and old town hall.
And those are accurate numbers. It just, when it says all town buildings flooring, 25,000 doesn't sound like the right number.
So it's a new line in the capital budget. It's using the phrase all town, the same way we refer to all schools. So that
Okay.
line is going to be in there every year. So we'll focus on a few different
Right,
departments.
it's piecewise, okay.
Correct, townwide. This upcoming year, I think we're going to focus on like the finance department, because the last time we replaced their rugs was close to 20 years ago. And then maybe in 2 years from now, we'll go over and do another department. And of course, the immediate need is any trip hazards, immediate tile replacements, but then we chip away at those departments or public spaces that haven't been replaced in 15 plus years.
It was just the discontinuity between all town and only 25,000.
Yeah, that is.
We have a
that's-
flooring line for the schools.
That's the jargon for,
We can adjust if it fits.
No, I
Future years.
understand it now. That's
yeah,
what I was looking for.
for these ongoing numbers, it sometimes it helps to have a generic title.
You know, I'm looking for overspends, but I'm also looking for underspends.
The next item is the DPW garage doors. We deferred that from last year's budget. And this year, they plan to come back and submit essentially the same work over 2 years. And this year, the focus is on the large equipment bay doors. And I have never actually watched them use, but they claim they're going to get ones that are faster. And therefore, at that place for the large equipment bay is actually a conditioned space, and so they don't want to let the hot air in or the cold air out by having the doors open too long. And next year we'll be addressing any other bays that are used by mechanics. And go to the next slide. And getting to the facilities in the schools, the highlight of this list isn't here. The high school budget boilers were budgeted this to be replaced this year for a placeholder that was $3 million. As part of the design work funded in FY26, the consultants evaluated the boilers and said they have 7 to 10 years of useful life left in them. Therefore, the remainder of the design work was closed out and the replacement number was not requested. The equipment line here addresses equipment that is for non-educational equipment. It's mostly for
It's like a floor scrubber type of
it's
thing?
floor scrubbers and genie lifts.
Okay.
And the ones that here that are beyond their rated lifetime. The flooring is addressed on a rotating basis, sort of like the town flooring. This is the school flooring. And this year they have Trip Hazards and Davis and JGMS. The painting is just sort of ongoing. They use a 7-year cycle, and this is the work is done by facility staff. I guess it's mostly covers the paint and supplies. The permanent space modifications is a little, I find it a little hard to explain. Is that, well, I find it easy to explain, but at the end of each school year, the principals are polled by the school department and said, are there any places where are any relatively small modifications that you can do, move a wall or something, or divide an office or what have you, or change a classroom into multiple walls. I don't know the specifics, but they call program space modifications. And this puts a little money aside for that. This is one of the ones that was scrubbed out last year, I believe, but this one, they prefer to have some money available to do that. And the BHS and Lane School intrusion alarm replacement, the high school and Lane School intrusion alarms are getting longer useful life. It's technology, they don't last that long. And the high school was last updated in 2006, the Lane alarm was last updated in 2002, and the existing ones can no longer be maintained, and the new ones are expected to have a 20-year life. The JGMS boiler replacement is somewhat analogous to the high school boiler replacement. They're approaching their stated end of, a conservative planning for end of life. This adds, we're allocating design money for anticipated replacement in 28. At that point, they would just be just short of their 30-year expected lifetime. And then when it comes to the furniture and equipment, furniture and equipment replacement, the furniture item, this is educational room that we're facing things. It's teacher desks, It's replacing the kilns at the, at Davidson Lane used for firing the pottery. There was some tech ed equipment at the high school. I think they're still using the Lego Nine Storms for robotics, so they're going to replace that. And then the last one, the school tech ed infotech plan. And this is, the school IT equipment is managed by school staff, and they regularly replace things, they replace things on an ongoing basis. The request is somewhat lower this year because the student Chromebooks have been moved to lease.
So Brad, this is the $500,000 we usually see every year to upgrade IT in the schools?
Actually, I think this year, Amy, correct me if I'm wrong, I believe this year, most of that money is for replacing the smart whiteboards
The
that
interactive
the teachers are
boards.
using,
Okay.
which are really getting deteriorated. They're actually overdue for replacement.
I just wondered if it was, I mean, we see pretty standard $500,000 every year for this particular type of
Yeah, the
stuff.
mix of what we're using
Yeah.
for is a little different. What
This is
Craig's
another
trying to say is
$500,000 here, but
we're trying to do a better job of not spending as much money on the Chromebooks and everything.
Yep.
And so that savings is in here, but there's a need for more of the whiteboards. So it
Okay.
kind of came back up to normal. But yeah, everything else on the list is a replacement.
They also have, I find it interesting is,
I hope that was corrected.
and they have charging cards for the student devices, even though the devices are leased. Okay, the next slide. Did I cover the flooring? I did.
Yeah, there were trip hazards in some of the schools, yeah.
Yeah, I remember that there were trip hazards around where you vote, at CGMS. The the town has an IT budget, that they said, I didn't compare it, there's somewhat lower number of the cost of the security software has been moved into the operating budget. It's a license thing as opposed to being purchased associated with each PC because the license has been moved from PC to PC.
Mhm.
And they're also, they pointed out that we're now done adding Munis modules. The Munis thing is going to be working.
Hooray.
I can just say,
Very exciting.
I was on the committee that bought what Munis replaced.
Well, the completion of it gives us capabilities that we didn't have before, which is the good thing.
It was a long time. The fire department, this year they want to replace one ambulance. They've got two. They use the newer one most of the time, but they use the second one while when they have two crews on staff. These were purchased in 2017 and 2019. They typically have a lifetime of 10 years, but they also have a lead time of 2 years. A lifetime of 10 years and a lead time of 2 years. And so this one will replace the 2017 ambulance. And now, if you go on here to the next slide, we have a quick, I will give a quick overview of the CPC. I believe the actual CPA budget, the CPC will be coming back to you middle of February.
Yeah, first or second week of February.
Yeah. There's some athletic field fencing, the Springfield Park, the playing fields and some of the parking that is outside the current gate for the Springfield Park. It's between the gate, the road and the gate. And I didn't realize that, I learned from the CPC meeting the other night, they're actually going to move the gate further closer, so that the 9/11 memorial will be outside the gate. And it's also converting a baseball field to a soccer field because it hasn't been manned. I guess it'll be a kid-sized soccer field. And then they're going to be replacing the lights Trails Committee gets a standard allocation every year. This funds bog bridges and things that are all done. They're all installed by volunteers with the need supplies. And then there's some historic things. The HPC has requested some money for signs around Bedford, possible locations including the Town Hall, the Old Burying Ground, Pitch Tavern, the old area of the original portion of the library building is eligible for CPC funds, and that there's areas where the painted will be getting a chip from CPC for that, and there's another HVAC thing, the HVAC system in Old Town Hall. This is the HVAC was installed in 2003. This is the design money in FY28. And then the last item is the Town Common rehabilitation project, bulk of the project that doesn't involve sidewalks, and I'm done with the CPC funds. And that's my presentation. I'm glad to take questions.
Karen, you want to start?
Oh, George.
Okay, George, you want to start?
Sure. The Town Common Rehab Project, when is that starting again?
When does it start?
Yeah.
It's, I think it's for FY27 money. If it gets delayed, it has a constraint because it wants to be done by the 2029 calendar year, 2029 tricentennial.
Yeah.
So that's under a relatively tight thing. So that's really fiscal year 27.
And the design work is already underway because the design work was appropriated at a previous town meeting, and this is for the construction funding.
So, sorry, the design is all done, completed?
Yes, we're finishing up design with Beta Group, and we've already gone through the HTC process, touched base with different stakeholder groups, including First Parish. So that appropriation with the third party is done. And so this will be the final round of funding requests through smaller capital, and then larger CPA appropriation.
Okay. Great. And then the Trails Committee, standing $11,000 every year. How often does the trail need to be fixed? And supplies
you'd be
of
amazed.
If you look at the Trail Committee, the minutes of the Trail Committee or the agendas, there are a lot of bog bridges out in this town. The places where they get places where it's getting too soupy. And there's trails over near me, and those the bog bridges are not built from particularly long-lived stuff. There's just like pressure treated and things. So I think they need ongoing maintenance. And I don't know. I learned this mostly by reading the agenda of the trails committees.
I walk the trails near my house a lot. They're a maintenance nightmare.
Yeah. Those bog bridges are not designed for 30-year lives.
No. Well, that's part of it. The other part of it is many places that still need bog bridges that don't have them yet.
Yes. Yes, I know.
And we're talking about basic wood, PVC, over like the dozens of miles of trail networks within town. So this is just the volunteers that put together small bridges so that the trails won't wash away. So it is volunteer work, and then the larger trail work that happens for ADA-related kind of trail improvements, such as the result of the trail improvement plan, which is kind of separate and then comes from a true consultant and design team, such as Davis Road Boardwalk or the town Forest Boardwalk. Those are those larger projects that happen about once every 5 to 6 years. But this is just so that a committee of volunteers doesn't have to spend their own, $100 to $500 anytime they want to go out and put some boards down to maintain trails.
Because I know they do get, there are places that get really swampy.
Yeah, I guess the 11,000 was just seemed a little high, for a couple $100 of board, I guess. if this is a standing cost, I understand if it's like
It actually was
5
10,000
years.
last year.
Yeah, and I'm happy to also have the Trails Committee provide a sense of how many they're actually improving on an annual basis and what that actually costs. I know they have a long list of their goals for the upcoming year, or places where they do want to make improvements, but I'm happy to kind of provide an overview and then add that back to you.
Sure, great. No other questions, just wanted to say thank you for putting together the comprehensive budget and keeping to, you know, like you mentioned earlier, half of what it was last year. I know that's gotta be done with all the different department heads, so thank you for being physically lean this year.
It'd be nice every department to be able to do that. I already gone through this list, with the capital community a couple of times. I don't have any particular question. It's much easier to read putting into PPT though. Thanks.
A couple questions. I think first off, I'm just looking at the 5-year capital plan, or whatever, I guess it's 27 to 32. After this year, it goes back to kind of the 12 million, 15 million, 20 million, et cetera. Is there a plan to go through and update that kind of once we get through this capital planning cycle to bring those numbers down to more realistic kind of estimates? Because I don't see us going back to, based on everything I've heard from finance directors of yore, that we're going to be going back to $10, $12 million capital budgets for a while. So just, is there a plan to kind of do that? Just because I worry that it's like you kind of hope and then all of a sudden things start building up.
The select board asked the same question, and one of the pieces of the bottom line of my documents that aren't shown on the documents that are shared with you all is kind of a reminder to staff internally, the town manager, the finance director, that as an example, the FY27 budget that had a placeholder in last year's capital plan, the bottom line was $21 million. So at the very start of the summer, when I started working with department heads, we were working down from 21 million. So we cut $14.6 million to present to you a $6.78 million capital budget. And then the next year was a $30 million budget, and I've already dropped it down by $12 million. The next year, 22, we've already cut off 10. And that's not to say we're just kicking things down the road. It's because we have placeholders for assets and infrastructure with the placeholder for the exact year that's determined to be end of useful life if you're running off of the contract, or that laptop should die this year. But the great thing is our facilities team, our DPW, all of our staff never want that to actually be the last year that we actually have to replace something. So we're constantly, as you know, reassessing things. And even if I'm looking with staff at FY27, it's great because I can sit with them and they can already look at 28 and say, oh, by the way, that big placeholder for $500,000 in 28, I already know that isn't going to need to be discussed yet. So we're already kind of reassessing what's down the road. So already my figures for the next few years are much lower, and they will certainly be even lower when they're coming to you year over year, because you're absolutely correct, which is we're very aware of the free cash policies. We're keeping an eye on our bonding capacity, and we're not just going to immediately come back with a $12 million, $14 million budget for the next 6 years.
And I'd just like to point out, I think you always wanted to have people who actually know how to spend money if you have it. They should have bigger dreams than what you can afford, as I think Ben was just asking about underfunding as well as overfunding. And so I think that's actually a healthy process.
Yeah, no, I would agree with that. I just want to make sure we're not setting ourselves up for having a lot of stuff in the coming years. And I guess that's my second question is there anything that we pushed out this year? I know you said we kind of tend to shrink projects as opposed to killing them, but is there anything we're pushing out or worried about that could be a bolus over the next couple of years that we need to be thinking about now?
Yeah, so I think there were definitely tough decisions that were made. There's portions of the town common project that were reduced in scope based off of feedback at town meeting, but also we kind of are gonna wait to see, you know, if we go out to bid, there's a portion of the project that we could add on, or it's designed that we could include, but that's also easily reduced, for instance. If we gave the DPW $2 million to improve stormwater culverts and drainage, they would spend $2 million in a fiscal year. But they just know that, you know, in any given fiscal year, we can't necessarily give them that. Flooding is an issue, environmental things, we see that in people's backyards, in roadways. So there's certain areas where they would absolutely love to not necessarily prioritize, you know, the new pump station on Carlisle Road, but they have to because it's part of our agreement with the developer. We also have other pump stations that we would love to improve, so they would love to be able to do both simultaneously. But those are not things that we're panicking over. It's just we're prioritizing certain locations over the other, and we know exactly where the next location will be in FY28.
So there's nothing really that you're worried that's gonna like potentially hit us over the next couple of years?
Not at this point.
Got it,
I
okay.
think, you know, if we have a wet summer, you know, people will be grumbling around the stormwater. I think this is something that's, for example, I discussed with David Newman, is that there's stormwater problems over at Harvard Road. Well, he's actually looking at further upstream control. He's taking a longer look at it and see it's not just fixing there.
Yeah, okay.
And that takes more time. And presumably would have more value.
Excellent. Kind of going back to the start of this meeting, just when I was looking at who was brought in for the capital plan and so forth, it was noted that the library wasn't included as part of that. Is there a reason why the library is not part of the capital planning, and is that something we should think about now that Jackie's on board?
They are entirely consulted through facilities.
I see.
Yes.
Okay.
And the conversation about why IT is not under the library, that is just because in the past couple decades, they've always run independently. They had their own point of contact with managing their own IT. Since Jackie has come on board, Dan Leahy and Julie Crane, we have all shared our method of tracking inventory, and we've shared that with her. So we're either going to she's going to match our method of tracking inventory because she does want, you know, some more organization there. And we are certainly going to have discussions that if we need to shift some of her budget into the town IT budget, if that is cost beneficial to the town, we'll certainly discuss that.
Yeah, I was noticing that as well, thinking about it from a capital perspective with the IT and so forth. So that makes sense.
And we've done that in the past where we've moved, the only budget that manages their own software is budgets that is incredibly specific to that department, like DPW running CAD and GIS, they manage that software subscription.
Makes sense.
And IT manages everything else. So we can kind of take a look at her department. But she was consulted, we did walkthroughs with Ron, myself, so she's rolled into the facilities.
Okay, excellent. The final question is more, I know things are expensive, but just, I think a heads up that we'll need to be very prepared to speak to at town meeting is the $350,000 for the design for the JGMS boiler. That just kind of stood out, especially just being design. I assume it's just because the boiler has pipes all through the building. You tell me if I'm wrong, but like it's complex, but just that one for a design, given kind of town common design angst, I think is just one that stood out to me that we'll need to be prepared to talk about.
Yes, explaining design versus construction for boilers. I will say, I think the last time we went to town meeting and had to explain that, as an example, the boiler project that we did not need to fund this year, I think it was overall well received, understanding that we are needing to assess the actual equipment that's there and then have a third party design it for the space. And then of course keeping our energy policy in mind. But of course the presentation and having a new select board member managing the capital presentation. I'm bringing capital slides back to town meeting, whether that's well received or not, but that will certainly be part of the presentation, so people will hopefully get a little bit more information.
Yeah,
Excellent.
it's sort of, it is, in this case, it's sort of, the design, and this is true for the fire station, everything, the design is done, general budget is 10% of the final.
Yeah. And it's a hard number to swallow, we get that.
It's good, so,
But it was well spent for the high school boilers.
yeah.
Right.
So could we have a similar situation with JGMS where they get in, look at it, do the design work, and then decide we don't need to change it?
That would absolutely shock Ron and myself if that, so these boilers are in much worse shape than
Okay.
the previous set, yeah.
Got it.
was very, very surprising to us that the review resulted in that many more years before construction funding for that last round of boilers.
Got it.
Pleasantly surprised, but it did.
Very much so,
Yeah.
yeah. Excellent. All right, no further questions for me. Thank you.
Thanks for another great CapEx process. Every year, it's always well done, well managed, well presented. But also, thank you for just having the fiscal, constraints of the town in mind, cutting the CapEx down to under 5 million. And, not just deferring it where it's gonna be, 15, 20 million 2 years from now. So that's certainly helpful as well. So do you know how much at this point would be bonded versus cash?
Nothing is being bonded this year.
Okay. All right. The traffic easing on Hemlock Lane, are those speed bumps coming back?
They are, so they were temporary, they're taken down in the winter so that the
Oh, all right.
plows don't
All right, they're
get
great.
damaged, and they will come back in
They're
the,
very effective.
And they're working on longer term.
they will be permanent as long as the temporary ones were successful. And I think that overall, once we get through the spring
Yeah.
season and the results, as long as they stay as successful as the fall, the intention is to put in permanent ones.
Yeah.
They're also gonna address some of the corners and things like that.
All right, that's good. So is micro paving part of the CapEx this year? Wasn't that on the schedule every year?
So paving is under the road resurfacing budget, and it doesn't show up in the capital budget just because it is funded through free cash. So you all see it in your
Okay.
model, but all of the paving is presented to you as one large million-plus number. But we don't usually add it here and get into the details just because the paving program is usually reassessed after the winter. It's usually a generally, 1.5-ish number. In the past years, it's been higher, but we're bringing it down given the financial forecast. But a few
Okay.
years back, we stopped including it because it wasn't ever going to be bonded, and it really was always funded through.
It also wiped out the rest of the capital budget.
Yeah.
It's very big. Now, this
Yeah.
is going back 15 years, but
So in terms of like cash usage, you're 5 million for CapEx plus whatever is for micro paving. Is that the right phrase, micro paving?
It's a lot of different types of paving, actually, so micropaving is one particular form.
Okay.
Yeah, but there's a variety of different methods that will perform throughout the town.
Yeah.
So the bottom line for capital is 6.7, and then CPA doesn't reduce the capital, it's entirely separate. So if that's the reduction that you were getting to 5, that's separate. And just to be clear, the CPA budget has changed and been adjusted because this was just the CPA budget as of September, October, and it's still, applications are coming in for that.
So the ambulance, since there's a 2-year lead time, how does that work? If
They're custom built.
I mean, in terms of like cash flow, if it's FY '27, we pay for it up front, or we just hold the money, or?
Yeah, so the way that it works is that we use a vendor that agrees to the purchase price, and we pay for it in the fiscal year that it is approved. But it gets,
Okay,
we know that
just
it
get
gets
delivery.
delivered at a later date.
Yeah.
But the price gets locked in and it's
Yeah.
contracted out like anything else would be.
All right. That's their second ambulance, right? Didn't they just buy one recently?
They have two, I would have to check the last date, but it wasn't
What
too
we were told
far.
is, the current one is, the new one is 2019.
Oh, okay.
You might be thinking of the engine.
That might be.
If there was one.
They
that
were
you
just by
wanted.
engine, right?
All right. All right. Thank you.
Again, yes, thank you for all of your efforts. Couple of questions probably rooted in ignorance, but bear with me here. First, what do we do with the old ambulance?
The old ambulance is going to be sold.
It's taken on trade, right?
Yeah, so,
In some cases.
yep, we can trade in vehicles, so oftentimes, if DPW comes in front of the select board and they're purchasing new vehicles, you'll see that a price might be reduced by trade-in value. With something like an ambulance, the fire chief will work with either this particular vendor to reduce this cost, or we will trade it into a company that wants to purchase it, and we get funding back, obviously.
Gotcha.
Yeah.
Cool, thank you.
Kind of just depends on the state of the vehicle.
That happens for a lot of the DPW purchases.
Understood, thank you. Second question, so great news about the boiler system that doesn't need to be replaced. Well, I guess this is two questions. One, so once we get to, what was it, 7 to 8 years out,
Yeah.
do we have to do another study and pay for another study? A design, I'm sorry? And then two, well, let's start there, and then I'll switch.
We would have the facilities department use where we ended the study, but they didn't design anything. So once they determined that we didn't need to move forward with replacement,
They don't.
we halted it.
Yep.
So we only ended up spending a small portion of that appropriation, and we did not have them design, and that was gonna be the bulk of that initial $100-something-thousand appropriation, which will get turned back. So it needs to be reevaluated, but it doesn't need to have as in-depth of an examination, and then it does have a normal design process.
Gotcha. And second part of that question, so we know we have this liability out there, right? Do we do any planning leading up to it, or do we even have that luxury to do so?
In terms of kind of watching that boiler,
Well, to the fact that we have, like, it's gonna be a major expense, right? Do we wait till we get to the tip of the diving board, or do we have the luxury to potentially plan leading up to that type of purchase?
we absolutely plan in the sense that all of our departments, myself, town manager, finance department, we're looking at those large years, whether it's a transportation project, a building coming down the road, boilers, and we're trying to space those out to have them be in the best fiscal year, so that we don't have a boiler and a transportation improvement on Wilson Park, and also, oh, we need to do the wing of, town center all in the same year.
Yep.
It is spaced out. So if we know that the best year to reassess the BHS boilers is now in 8 fiscal years, we're gonna do that design again.
Mhm.
And then the following year, we'll have construction. And I will look at anything else in that year and kind of take a look at what else is to the tune of $2, $3, $4 million. I say that obviously not including escalation.
Sure.
And I work with the department heads to make sure that we don't have 5 $3 million projects in that year. And that's how we kind of look
Gotcha.
at
Understood.
what's a priority.
What's the rightmost column on your spreadsheet? 2040?
Well, we have I don't want to get into the weeds. I mean, the facilities department has a 50-year capital plan, but that's like because they have,
50-year life.
they have their lifespan of, the end of useful life for certain things. But it is on our radar now, and there are many hidden columns that go
Sure.
out that are those reminders.
Thank you. Thanks for bearing with me. I was unsure.
Similar, like, there's a placeholder for the future replacement of the Savard field turf.
Thank you.
Yeah.
Craig, thanks for slowing down all of this with us and for the level of transparency. And Amy, I can't think of a person better qualified than you to kind of stare down those department heads and help us hold the line. It really is deeply appreciated. Phil asked the two questions that I was they were most top of mind for me, just about looking further out. I mean, it's great to see the town common stuff. I think we're getting great value out of the reduced scope that we agreed to. It's terrific to see the outdoor improvements at Lane. That's where some of the best learning at Lane happens, and Craig will know that I appreciate the paving of the little strip along the parking lot to the bike path. I think and the Trails Committee gets more done bang for the buck than 80% of this town. The outdoor lands are a treasure, and I have walked most of those 36 miles of trails and walk some of them every day. So that's money incredibly well spent for the green space of this town. I think Brad, we touched on the infotech replacement. The interactive boards are 65% of that line item. It's not clear to me, the ones, I mean, I've seen how much the teachers get out of those. It's really something. What we have in many places is quite outdated. How this investment of, $324,000 or whatever it is this year, where can I find out how can I put this? How many have already been replaced? How many does this cover? How many are yet to be replaced until we've covered all the classrooms where they belong?
In terms of the smart boards.
For the interactive
specifically,
smart boards, yeah.
I'm more than happy to provide a list of what that looks like.
Okay, I don't need it now.
Julie has, I know some of the backup is in there. They keep a very detailed inventory, in my opinion, and I think that if we do want to kind of get more in the weeds of the specific kind of classroom and what that replacement looks like just for the boards, and kind of what that replacement looks like for that specific piece of equipment, I'm happy to.
Okay, I know it's really become central to how they present to the kids.
Yeah.
So
I can follow up with her.
Okay. I'm sorry to slow down on this. Phil, I had exactly the same thought about the design work for the boiler replacement. Did I understand right that it's not just a design for the boiler, but for everything that it connects to?
Yes, and also the energy efficiency component.
Yeah.
So when we're redesigning infrastructure and we're wanting it to be energy efficient and then future potentially ENZ ready, there are design components that are not just as simple as replacing exact pieces of equipment. One of the great questions from CAPEX is also, is there a way to have one person kind of design that Bedford, specific energy efficient boiler for all of our schools? And unfortunately there's not. It has to be space specific, school specific, given the size of the school and the needs. And yes, it's very helpful to kind of be reminded that although the facilities department, the school department are very aware of kind of the first stage of design and what goes into it, that is normal to us. It's not normal for the average homeowner to be like, what are you talking about? Why do you need to design this HVAC system? Or a boiler system? So yes, we'll absolutely kind of have a breakdown. Similar to, there's a CPA project where we're just asking for design work this year and construction work next year related to Springsboro. And we want to make sure people understand.
HVAC in there too.
Okay. I mean, even the addition of the word system for boiler, I think, could help. I mean, to proactively mitigate the angst that Phil mentioned, right? Just making sure that the scope is clear, because again, as you just suggested, as a homeowner, when I think of a boiler, I think of taking one device out and putting another device in. Whatever you can do to make sure the scope of that design work is proactively well communicated and be ready if somebody starts getting their pitchfork out, to give a full-throated defense of the need.
I do think the other important point to make, and I don't necessarily want to dwell on the prior fiscal year, is that the reason why we split it into design and construction is exactly for what happened last year, which is you occasionally get that moment of, I don't want to make everyone commit to $4 million in 1 year if only, 300,000 of it is for design work. And then all of a sudden, we could have had $3 million of capacity for stormwater work or the school department. So kind of reminding people why we do want to break it up over 2 years would be
That's a great point.
It's a fantastic story. I mean,
Yeah.
it just could maybe use a little bit of marketing.
Yeah.
We're not just buying whatever's in the warehouse.
Yeah. And again, you don't have to go above and beyond proactively, but do what you can proactively and be ready if it becomes an issue. Thank you. That's all. Yeah.
Thank you for like a really thoughtful, thorough presentation and review of what we need to do here. And I think my question was similar in terms of what we're looking at in the years out. And I think you answered that, but I'll ask it another way, I guess. Have there been years past where we've kind of reined in some capital spending and then felt some pain for that later? Is there any like history lessons in?
It was that truck. Dave's got that.
There are very small examples and there are certainly larger examples. A very easy to understand example is kind of pushing off something like a DPW back truck that we probably pushed it 1 extra year, it broke, and then all of a sudden it was $15,000 a month to rent a truck because, a $250,000 piece of large equipment didn't get replaced because we wanted to get 1 more year out of it. That's an easy example of just kind of thinking we have 1 more year, 1 more year. The bigger example, in my opinion, is just really doing a lot of deferred maintenance on larger infrastructure such as sewer pump stations, and also maintaining things like water meter replacements, which we've kind of caught up on, or water main improvements in general. Having recurring lines, I think, is a concept that is somewhat hard for some people to understand, that by the time you finish sections of the town, you're 30 years later and you're going to another section of the town. And it's expensive to, dig up the ground and, replace water mains. But there's certain things like that we've had certain years where we've cut that budget to $100,000 when really it should have been probably $400,000, $500,000. And there is a level of catch up there for certain items. So it took a few years of kind of getting it back to a consistent level of funding. So we at least could every year go out, get a contract, and start doing steady replacement work.
Another thing that doesn't get anywhere near enough credit, in my opinion, is our current process for capital. Back in 2011, we were talking about moving to a software-based system so you could actually roll it. You could put big items further out and you could see what was coming. And that really changed the game here. Changed it a lot, and I think it gets a lot of credit for how we're able to manage now.
Yeah, there's so many moving parts to how to make these decisions. To hear the depth of your thought process on it is really nice. I appreciate that a lot. And yeah, that was the main thing. The other thing I'm wondering about is you mentioned bonding capacity, and how do we determine our bonding capacity?
So right now, that is obviously a discussion with our office and the finance director. We've had a couple prior years with a good amount of bonded projects. And we were getting close to the finance committee's guideline of, I can't off the top of my head, Ben, you might know where you're at in terms of the percentage of
Our debt service limit?
your debt service.
I don't remember the number anymore, but we're getting
10%
squeaky close.
Right, you were close enough that knowing that we were gonna have a lower capital plan this year, and knowing that the past few years, we were getting very close to that, your preferred policy figures, it was very appropriate, given the prices of our projects, and this year, and knowing that we were gonna have a few years where we're now kind of looking at those figures and having much smaller capital lines, that we can take a step back, and we didn't feel like anything needed to be bonded this year. So every year, it's a discussion with the finance director, myself, the town manager, to check that percentage, look at the projects, look at the prices, and see where we're at and what's an appropriate project to bond, and then obviously look at
Yep.
the capacity.
I think guidelines help us.
Yep.
It makes it easier to follow and stay out of trouble.
Especially it's, I mean, it's incredibly complicated, the number of moving parts that go into this whole process, so,
Yeah, we,
appreciate that.
sorry.
No, go ahead.
There are definitely, seasonally times where we're still deciding what, in prior years, what could or should get bonded. And CapEx is reviewing the projects, and it's not their concern necessarily what's getting bonded, but myself and the finance director and the town manager might be saying, all right, maybe it's these three, oh, maybe it's just these two, because these figures are looking good, and it kind of just depends on where we are and honing in on estimates on pricing, quotes, and then where we're looking.
It rolls into a debt exclusion discussion,
Right.
which then the fun really starts.
Right.
And we're still AAA and all that, so I haven't seen any of those write-ups in a while, but, all right, that's it, that was it for me, thank you
So
very
I had a
much.
few questions and comments left over. Going back to your sewer pump station program, that made me think about, that's being put in, the one up on Carlisle Road's being put in to handle the new development. Well, we're about to have a lot of new development in this town, and I've talked to a few people about it, but I want us to keep our eye on the ball of the fact of what will capacity be. The water line pipes that are 100 years old and got relined recently, are they sufficient capacity for what's going to happen in Loomis Street, for example?
Yeah.
I don't have a direction, it's just, you will keep your eye on the ball.
Yes, and I guess the most I can say about that is that we have excellent department heads that are on top of incoming developments and meet monthly to have permitting meetings.
Good.
So all of those meetings, there's a variety of people with different concerns, but the main objective is to have planning, DPW, facilities, health, engineering, all aware of what could, may, potentially is canceled, what is coming, what that means for stormwater, what that means for pump stations,
Right.
what that means for sidewalks.
It's incredibly complicated.
Incredibly complicated, and also then discussions about fees that code could or should not waive, or what a requirement might be for a developer to require them to pay for an improvement, such as a pump station improvement or water line improvements. All of that's discussed in those meetings so that it doesn't get missed and then it doesn't fall on us.
Right, because
And
that
there
would
have
be
been
catastrophic almost.
many discussions with people that want to have construction in town where we have to kind of remind them that things can't just be built and then have the town sneak in a new capital plan, a new capital project,
Right,
6 months from now, because it's not funded.
okay, so your eye, my point was, we gotta keep our eye on the ball, and I knew you
Yes.
would have it, but I like to bring it up periodically. We had a lot of trouble in town meeting for a couple of years until we got our hands wrapped around, as you said, the slides, and that made things better. The wording, you have a DPW slide with vehicle and equipment replacement with a number. The verbal wording you used for that made me think that, well, if we have extra money, we'll buy the hybrid, whoopee. And I know it's not like that, but you ought to watch out at town meeting how you present that. If it comes across as extra cash, isn't this great?
Yes, the way that it is intended to read, which we can make sure to say it, is certainly we will clarify what is being purchased as a hybrid, what is being purchased, if it's just a piece of equipment. And the understanding that, sometimes we think a vehicle is going to be $50,000 and it's $44,000. And the point is, if we have that happen, 4 times with the top 4
Yep.
pieces of equipment, and we have a remaining $20,000, that $20,000, our next vehicle in line might
Right.
be
To me,
this.
the theme is efficient use of cash.
Right.
I just wanted to point it out because the way it came, I don't mean anything bad, but the way it came across tonight, I was like, ooh, that's not gonna go over well at town meeting.
I think that this was also trying to meet several constituencies, because people want to, there's also, I know that Dave Mnuchin always is careful to explain to us that no, you can't buy electric heavy equipment yet. he's trying
Right.
to explain that we're trying to meet the town's energy guidelines as well.
Right.
And that was how it was conveyed to us. And some people in town meeting will be looking for, why isn't everything electric?
No, I understand that, it's just, it's.
More people are worried about the money.
As Amy knows from years of experience, what we say is often intended to help town meeting presentations of the group presenting to us. Just, we heard it this way, you may want to think about the wording is all. Oh, water main improvement program and meter replacement program. Is that also going to be turbocharging or just increasing the probability of a different billing cycle for water? That was a discussion at one point. We could do monthly,
That
do
was a
13,
stated goal.
yeah, do 13 zones in the town, one for each month, and I forget what the 13th one was for, but
The 13 zones in the town, and different billing cycles. Different billing cycles is certainly still being discussed, to have more efficient and effective, ways to catch errors in water
Yep.
billing, as well as the, infrastructure improvements that Craig reviewed.
so this is in service of that.
Yes, yeah.
Okay.
This
But-
makes that possible.
Right, well, that's an important point, and that's a good check off the box column. Where are we with lead replacement? Is that like behind us yet, or?
Almost.
We have none of the town-owned service main lines have lead in them. They're continuing to check to see if the service lines that drops to the house, they looked in, a number of places, including a friend of mine who has a very old house, and they haven't found any.
Okay, that's just, to me, a potential gotcha for, spend more money because we just got
That's
lots
the
of
reason why
lead.
there's money budgeted there.
Right, okay,
The money budget, I think, is more than would just need to be checked for checking. That's why.
Right, because we would replace it if it were to be found, it would be closed out if nothing is found. The great news is, we've found nothing as of now, and we can stress to town meeting that this is all based off of a federal requirement to replace these lines and to do an inspection.
it'd be good to repeat it, I know it was in the letter that we all
Yes.
got, in fact, I
Yes,
think I
but
got
that
one.
was so long ago, the
Right.
last week.
I find it interesting. It's actually not just lead, it's lead and copper because the copper is soldered.
Okay, yes.
Now, I think they use compression fittings now, but that is not what they did years ago.
No, no, compression fittings are a relatively new invention. So, that's all I had on that one. This is unfair, I'll tell you right now, this is unfair, but the facility/town one, deferred from last year's capital plan due to budget cuts, that just made me cringe. It was budget cutbacks or budget. It sounded like I didn't like the phrasing cuts, that's all. It just could have been worded better, but,
And this is something, I don't know if this is town meeting wording, this was specifically a thing for town boards. But it was true, that this is the one thing that we had specifically that was deferred last year.
right.
I don't know exactly, say why it was deferred, we just say it was deferred.
I'd just like to exercise caution when, there was a time when we had a lot of trouble. In fact, I'll just go out of order. I'm really glad you're bringing the slides back. I missed them. There's a reason we have those slides, and that's because you were probably there for the really horrific town meetings we had before the slides came to life.
Well, and to your point, town meeting didn't hear about the garage doors the first time because we already removed them with you all. So
Right.
we won't even, in the warrant, it won't be referenced that they
Right.
were removed because the floor of town meeting is gonna be like, what are you talking about? We didn't even talk about this last year, so we won't reference that.
Don't wave a red flag in front of a bull.
Right.
But on a positive sense, I'm really pleased you're bringing the slides back because those are important for quieting town meeting down and getting people to a common base of understanding about, no, these are rational choices and they're the right choices. So I'm happy you're bringing it back.
You can present them if you want.
the Bill Moonen Memorial Slide Program.
Maybe I can tell him to come back and present them. Well,
So-
Terrence will be his first year doing it, so hopefully they'll help him.
Here's another one that I have some thoughts on, but I think there's nothing we can do about it. The fact that the ambulances are 2 years apart scares the hell out of me.
Yes, so that was intentional based off of feedback from the vendor and the fire chief. In terms of guaranteeing the pricing for this year's ambulance.
Okay,
It locked in pricing for both of those by committing to purchase them in that particular,
that's an important part of the explanation. I'm not advocating you put it on a slide, but
yeah.
now my opinion of that is completely different. It was a rational thing to do, it was the right thing to do, because when we're buying, we're locking in a price. That's
Yeah.
the key thing. Okay, I just saw a big, big bill in 2025 for, not, well, whatever, get the years wrong, but. Springsboro Park, we're doing some redesign. This is CPA, so I know it actually doesn't matter, but I'm looking at slides. Does this impact the redesign that they're going through?
Yes, and.
So is it right to spend the money now? That's all I'm asking.
So the rec commission has decided that they would like to work on, if you just essentially think about the gate forward,
Yep,
that the fields in the front and the parking lot prior to going up the path past the gate, this is a good portion that you can carve out separate from their analysis of the future use of Springsboro Park, which was a goal of the select board that rec come back to them and make a recommendation on the future use of Springsboro Park. We worked with the consultant, Weston Sampson gave us, one whole option, they gave us a 5-part option, and one of the options was just very clearly redesigning those fields, redesigning that parking lot, and it just was very clear that that chunk could be done first. If there's a need for those soccer fields to be redone, the parking lot, everyone knows that gravel parking lot is like, can get washed away very easily.
Yep.
So they just figured that was great to kind of tackle that first, and then we all can focus on redesigning that road, carving out the memorial, going up the road, making it safer, well lit, and then doing the back
so
portions of it.
we spend the money once.
Yes.
Or unlike Karen's favorite topic, how many times are we gonna dredge Fawn Lake? How many times are
Well,
we
there
gonna
will
redo
be,
Springs
there
Road?
will not just be one round of funding. I would be shocked if there was one round of funding for Springsboro Park, but this is one,
I
this
just-
is one project.
I didn't wanna see a round of funding to fix the fact that we just broke everything we did.
Yeah, no, this is its own thing. It will remain in place, and then the back portion of Springsboro will come back as a different.
Like I said, this is CPA, they're gonna do what they're gonna do, so. I think that was the end of my silly comments. And like everyone else, you two were fantastic. Thank you very much, Craig and Amy.
I can follow up with some of the information you've asked for, and I can share it with you all through Dropbox.
Thank you.
Thank you.
Thank you.
Well, that took a while, but it was worth it.
One thing is, the town manager said he was listening in, and so if you have any questions that you need him to answer on the model, he's available.
I don't think we have a new model. on
Okay,
the
I didn't
job.
know if he just wanted to.
No, he
text
put
us
one.
in.
He put a new model into the Dropbox
Oh, I didn't see
today. So
Matt, just raise your hand if you want to talk.
Well,
We would,
I know
but don't feel the need.
Just enable him to talk.
he probably fell asleep during my discussion. All right.
I have the most riveting voice, I'm sure.
Whether you want to try and make progress on the model. I haven't read the new one
I-
for a variety of reasons.
I think we
including
could-
I couldn't find it.
no, I think it was added this evening. So just kind of, I guess, on the model, one of the questions from last week was, do we have a no updated model with the latest guidance? Matt put a new model in today, and then answered several other questions we had from last week. So I'll forward that email around to everyone so that you guys have that information as well. And then he highlights where the model is in the Dropbox. So in the email, so you guys can go and look at that, and as we start to refine kind of where we're going with all of these numbers.
Do we have any minutes?
There weren't any in the Dropbox. last week's meeting was.
And that being,
I know last week's, I'll do this week's at the same time.
okay, thank you. It really is a high priority of mine to find somebody new to do it.
Matt's working on that as well.
Right, that's usually who I get to do these
Someone
things.
from the town, you mean?
Yeah.
And we do have a stipend we allocate to whoever is doing it, so.
You could pay me to do it.
I mean,
Okay.
Yeah, oh, thanks.
He said they have another staff member interested and should have the details confirmed before our next meeting.
Yeah.
I make a motion for Tom.
I would say a lot of people nowadays just use Copilot. I don't know if our software is up to par to do that.
Zoom's perfectly capable of summarizing.
Yeah, we should be able to use some of the technology.
Oh, really?
Yeah, good
Well,
idea.
actually, I can really quickly just tell you that I've confirmed that there are vaping curriculum in both the high school and in Chase Chase.
Okay, great.
So, yeah,
Good to hear.
we're doing it. I thought so, but I didn't want,
I just want to make you wait for our whole agenda.
Well, actually, I thought you were almost done, but yes, thanks for asking.
Thank you.
That's right.
We hope, we hope.
I was here for moral support, so,
Oh, yeah, see you here.
yeah, take care, everybody, thanks.
Thanks, Brad.
So, meetings attended, I assume the usual, not many meetings attended?
No.
Okay, in which case, we have one last thing.
I would move that we adjourn.
All those in favor?
Aye.
Opposed? We're adjourned. Thank you so very much.